Salamat po, o dakilang may lalang, sa mga gabing mahimbing kami sa pagtulog sa mapayapang tanglaw ng mga tala at buwan. Salamat po sa aming bawat paggising sa umaga na sinasalubong kami ng masiglang sikat ng araw. Walang kasing sarap ang mabuhay at walang kasing saya ang makapiling ang mga mahal namin sa buhay. Kung ito man po ang bigay ninyong inspirasyon upang mapalaganap namin ang pagmamahal sa aming sarili, sa kapwa, sa kapaligiran, at sa aming bayan, tinatanggap po namin ang hamon na mag-alay naman ng paglilingkod para sa pangkalahatang kapakanan. Alam namin na ito ang wastong kapalit ng pang-araw-araw ninyong biyaya sa buong sangkatauhan. Lahat kami ay hinahayaan po ninyong dumaan sa paglalakbay ng aming mga buhay na may tungkulin namang mag-iwan ng bakas na kapaki-pakinabang sa aming bawat hakbang. Ipinalalasap din po ninyo sa amin ang masaganang biyaya ng kalikasan sa pamamagitan ng mahabagin ninyong kalooban. Naway maging katanggap-tanggap kami sa oras na kami ay hihimlay naman sa kandungan ng kalikasang binabasbasan ninyo na aming pangalagaan. Sumainyo ang luwalhati ng kataas-taasan. Kataas-taasang hinahangad naming naway maging kasing taas ng aming pag-abot sa hangarin na magkaroon ang aming bayan ng pagkakaisa, pag-unlad, at pangmatagalang kapayapaan. Salamat po.
And we will now proceed to the Philippine National Anthem.
Mga kababayan, ang pambansang awit ng Pilipinas.
Thank you.
All right, so thank you so much for tuning in, guys. By the way, we will be flashing the attendance QR code, which you can work on. So you can also access the attendance through the link bit.ly/attendance ENTGP. So, yep, it's your now time to scan the QR code. And by the way, before we start with our today's event, we would like to remind some online etiquette that we should practice on this event. So first, we should avoid distraction. So join from a place where you can focus and ensure your workplace is quiet, clean, and has an appropriate background, or use a virtual background. And also do not forget to change your display name. And as much as possible, we wanted to see the society that you are in prior to your first name so that we know where you guys came from. And then mute your microphones. We're not speaking. And at the same time, do not hesitate to use the chat features. So if you have comments or suggestions, we will be able to, or you'll be able to use the chat option. And at the same time, we will address all the comments and answer your questions after the sessions or during our open forum. Next is be engaged, unmute your mic, and identify yourself before speaking as well. And yes, do not hesitate to share your feedback. So again, just an overview, quick overview on our town hall program. So after the opening remarks, then we will be having our first session, which is the overview of the AO number 2023-0002, or the institutionalization of the expanded NTGP. Then we will have the 5-minute wellness break around 10 a.m. Next would be our session 2, the updates on the clinical practice guidelines, development process in the expanded NTGP. And then at 10:35, we will be having the open forum. And then hoping we could stop at 11:30 or prior to lunch. So we'll be glad to let you know that today we will be graced by Assistant Secretary Beverly Lorraine Siho, or Doc Bev, who will give her opening remarks. You can now chime in, Doc Bev.
Hi, Doc. Doc Chelsea, may I just ask for my video to be open? Thank you. If host, yeah. Okay. Thank you very much po sa inyong lahat. On behalf of the Department of Health, we'd like to express our sincerest gratitude to everyone, all 600, almost 700 strong health workers with us this morning to join this town hall on expanded national practice guidelines program. On behalf of the entire DOH, we would just like to say that this is a critical step towards working on quality of care. No? So for many, many years, mas ang focus natin is on access to care, basta mabigyan ng serbisyo. Pero ngayon, no, increasing emphasis with more resources in the health sector, hindi lang basta nabigyan ng serbisyo, we have to make sure that that service is of quality. And definitely, when we talk about quality, it has to be evidence-based. This program is not just a program of the Department of Health, because it will actually not be successful without the support of many of our evidence reviewers all over the country, and our co-convener, the UP National Institute of Health, Institute of Clinical Epidemiology. I'd also like to take this opportunity to thank the movers within the DOH, no? And that would be the team of Dr. Nika, Dr. Divine, the entire EGMD team, who actually had to start, no, from the very beginning to make sure that we have internal capacity to keep this going. Ang commitment po namin sa inyong lahat is we will continue to put out updated guidelines, particularly for conditions that are being seen, no, by as many primary care providers, because that's really our priority under the UHC Act. But we will definitely not work alone, no. Katrabaho natin many practitioners, and we hope to build as many evidence consortia in the entire country in the years to come. So for many of you who are practitioners, rest assured that we will put in more effort to make sure that whatever guidelines are developed, mas mabilis niyo siyang ma-access, mas mabilis niyo siyang ma-search, at syempre, no, na-update siya, because those are actually the things that we found out that were challenging for many of the guidelines in the past. And then finally, we'd just like to say that we will keep communication lines open. The EGMD team will be sharing their institutional email address, no? So that if you have feedback on how we can make this national practice guideline program better, definitely we will try to accommodate as much as possible and serve you all better. So siguro mag-hello lang din kami to all the experts who are with us today, who've made this initiative possible. Ako si Ma'am Shelly, di ko maka-hello po sa lahat. Pero maraming salamat po ulit, and tulungan niyo po kami, no, to make this a program that is alive, that is useful for you as frontline healthcare providers, and not just to us, no, na basta nagawa lang namin. Let's make it useful, and definitely this will also input into many of the benefit packages that we hope PhilHealth will be able to come up, no, so that we can cover more conditions for Filipino people. So I think I'll stop there. Thank you again to everyone, and congratulations to our EGMD team for mounting this activity. Maraming salamat po. Over to
Thank you
you.
so much, Doc Bev. And can we please flash the poll on the screen? Thank you so much. So we will be having an online poll. You can scan the QR code now. We will be giving an ample time, or you can access the link or through the link. So the online poll pretty much will be just how we will be able to gauge you or our participants. So this comes in 3 questions, actually. Can we flash the first question now? So I hope everyone has accessed and answered the poll. The link to the poll will also be posted on the chat box. So good morning, everyone, again. So yep, here it is. So the first question, which of the following best describes your current affiliation? So let's see. Okay. So I think most of our attendees today are healthcare provider. Okay, I'm also seeing those who are coming from our regional offices and some academic researches. Okay, thank you so much. Next, please. So how familiar are you with the DOH National Practice Guidelines Program? Let's see. Okay, I think we have a lot of both under not so familiar. Anyway, we will be explaining it today, which is good. So, okay, we understand that. Okay, moving on to the next question. What are your expectations for this town hall? Hopefully, we will be able to answer your expectations or any clouded questions in mind after the town hall event. So yeah, let's see. Okay. The expectation of most of the attendees were focused on or more on the familiarity on the overall process. Okay, I think pretty much covers the poll. So we will now proceed with our session so that your questions in mind will be addressed, and we would like to have this opportunity to present or to welcome our division chief of the Evidence Generation and Management Division to discuss the overview of the AO number 2023-0002 or the institutionalization of the expanded NPGP. Let us all welcome Dr. Ruth Divine D. Agustin.
Thank you, Chelsea, for that kind introduction. Am I audible?
Yes, Doc.
Thank you. So, so dearest colleagues and stakeholders, a pleasant morning. In this presentation, I will be talking about the background of clinical practice guideline development in our country, why there is a need to enhance and strengthen our capacity to develop and implement guidelines, and what are the opportunities to contribute to the expanded National Practice Guidelines program in these exciting times. So first of all, I want to start by giving you a background of how evidence-based medicine and evidence-informed decision-making have become thoroughly interconnected in our country within the past 2.5 decades. In the 1990s, evidence-based medicine or EBM workshops were conducted by our well-esteemed partners from the health sector. Back then, the focus was mostly on the use of guidelines in clinical practice, but this was not yet married with public health implications. A breakthrough was accomplished in 2004 when the first Philippine guidelines on periodic health examination was published with multidisciplinary collaboration. But there's a little bit of recess in between. More than 10 years later, a situation analysis, including a CPG scoping report and a CPG methodological quality study was performed, which revealed various gaps, including the lack of standardization and the inconsistent methodological quality of CPG development in the country. A glaring revelation in this situational analysis is the lack of transparency in terms of conflict of interest declaration and assessment as a critical process in guideline development. And this is very important because we don't want patients and policymakers doubting the veracity and the integrity of our CPGs. To address this gap, the DOH and PhilHealth jointly published a manual for CPG development in 2017, but probably this was under the radar for most of us. A lot of CPGs developed during that period or after it were not able to utilize the methods and processes prescribed by the manual. In 2018, a capacity mapping study was done by Dr. Dance and her colleagues, and this revealed that among the participants surveyed, only 58% had knowledge and skills in CPG development, and only 30% were able to provide training. In 2019, upon the passage of the Universal Healthcare Act, the UHC Act actually included several provisions mandating evidence-based healthcare. So these include DOH setting standards for clinical care through the development, appraisal, and use of clinical practice guidelines. In cooperation with medical societies and the academe, the performance of evidence-informed sectoral policy and planning, the conduct of local research to guide health policies and decisions, and the emphasis on evidence basis and scientific defensibility of health technology assessments to guide public funding of health technologies and services. In 2019, the DOH started commissioning CPG development by funding through the AHEAD program, with concomitant capacity building and strengthening activities of key stakeholders and TWGs. And then the COVID-19 pandemic hit us in 2020, which really increased the demand for evidence-based guidelines and decisions. From 2021 onwards, several simultaneous high-impact endeavors occurred, and these include the updating of the Philippine Periodic Health Examination Guidelines, which focus on screening and prevention standards of care at the primary care level. And of course, what most of us are probably familiar with, the Philippine COVID-19 Living CPG, which really is a laudable, dynamic, multi-stakeholder collaborative effort that provided an important anchor for COVID-19 services and health technologies, not just to the public sector, but to the private sector as well. So in 2022, we were able to formalize the relationship of DOH and the University of the Philippines National Institutes of Health, Institute of Clinical Epidemiology, to develop 24 CPGs in collaboration with different national specialty centers all over the Philippines, medical societies, and organizations, and then update the COVID-19 LCPG and the PHEX, and bolster capacity building efforts in CPG development, research, and evidence-based medicine. Further, DOH-wise, we have released several policies recognizing the importance of guideline development and implementation, defining the roles of multiple stakeholders, the types of guidelines the DOH supports and uses, and the criteria for recognizing CPGs as DOH-approved CPGs. In June 2022, we published the Omnibus Health Guidelines through AO 2022-0018, which integrate and consolidate various standards of care for Filipinos of different life stages, with high-quality clinical practice guidelines and evidence-based policies as the foundation. And in October 2022, during the National Health Research Forum for Action, or NAHARAFA, we launched the National Practice Guidelines Program, and we recognized the inaugural batch of DOH-approved clinical practice guidelines. And then early this year, we were able to solidify through Administrative Order 2023-0002, the institutionalization of the expanded National Practice Guidelines Program, which basically recognizes, harmonizes, and operationalizes the entire knowledge to action processes, inclusive of evidence generation and synthesis, translation into CPGs, and evidence-based policies and standards for safe, effective, timely, and patient-centered care. So as part of the continuing efforts to facilitate the standardization and professionalization of guideline development, just this February 27, 2023, we affirmed the alliance of DOH and UPNIH by signing a memorandum of understanding on strengthening collaborative efforts on health promotion and the expansion of the National Practice Guidelines Program. So now, given all of this background information, there might be a lot of questions running in our minds. For instance, why is there a need to expand the National Practice Guidelines Program? Why do we even need a National Practice Guidelines Program? What does it mean in terms of universal healthcare and health systems strengthening? And to answer this, we have to understand the connection between evidence-based healthcare, universal healthcare, and integration. Evidence-based healthcare can help ensure that universal healthcare systems are effective and efficient. So by using evidence-based guidelines, our healthcare providers can help ensure that patients receive high-quality care. And this can eventually reduce healthcare costs, improve access, and improve health outcomes, which is a key goal of universal healthcare. Through the expanded National Practice Guidelines Program, or NPGP, The DOH espouses and facilitates the development of 3 types of evidence-based guidelines, including interim public health and clinical guidelines, which we usually release as department memoranda. For instance, for monkeypox, we release various DMs when there was no formally created clinical practice guideline yet. And then, as mentioned, the Omnibus Health Guidelines, which integrate the standards of care per life stage, and of course, the DOH-approved CPGs. So why is there a need to integrate? And how do guidelines promote integration? So integration is needed to ensure that there is continuity of care for all Filipinos across life stages and in different settings, and that there is reduction of healthcare disparities and improvement of health outcomes for all individuals, regardless of where they are located or what their socioeconomic status is, which is also really the goal of standardization. And then we want integration also because we want to ensure that there are functional and unified referral networks within the health system. The expanded NPGP encourages the development of guidelines that address the needs of different life stages, considers the different priority areas of health promotion and health improvement, and tackles approaches designed for different settings. This approach to integration ensures that policy, planning, and delivery of health and health-related services are responsive to the needs of the totality of the persons we are caring for. And this is also in line with the most recent health sector strategic thrusts of caring for health and wellness and enabling Filipinos to be healthy at all times and in all settings. Further, integration through the National Practice Guidelines Program can help us shift from fragmented to integrated standards of care to fulfill gaps in primary care guidance. Previously, a lot of CPGs were developed for or only accessible to certain specialties, but primary care guidance was relatively lacking. And then to address this, to respond to this need, we now have the Omnibus Health Guidelines. So the Omnibus Health Guidelines have sections for children, for adolescents, for adults, and for elderly. And then we have life stage-based algorithms. We have the Philippine Periodic Health Examination. And then we also have disease-specific guidelines, which are the clinical practice guidelines. As of January 2023, 34 clinical practice guidelines, which have passed the quality appraisal of DOH, have been included in the compendium. And we want to ensure that there is access because we want to ensure that all healthcare providers deliver healthcare which is safe and of sufficient quality. The operational framework of the expanded NPGP involves the entire spectrum of processes from evidence generation to practice to monitoring and evaluation. Hence, this framework, as illustrated by this graphic, identifies various information sources, ensuring the quality of these sources through quality appraisals, and then setting standards of care through CPGs, interim guidelines, and the Omnibus Health Guidelines, disseminating this through various means, making sure that they are utilized in policies and decisions, and supporting their implementation in actual service delivery, plus monitoring and evaluating for impact. So this is a busy slide, but it summarizes the different sub-activities needed to ensure the continuity and comprehensiveness of the entire process. So these activities are also opportunities for our stakeholders to be involved in the expanded National Practice Guidelines Program. So for instance, in terms of the academe, we encourage local primary researches, which are directed towards addressing gaps in evidence that could improve or introduce new ways to deliver standards of care. We also have here facilitation for HTA, PhilHealth, and FDA in terms of utilizing the products of the National Practice Guidelines Program. For instance, the guidelines, high quality guidelines can actually help our HTA and PhilHealth and even FDA. And then we also encourage stakeholders to participate in monitoring and evaluation. So participation, for instance, in stakeholder consultations and practice surveys. So as mentioned earlier, what we really want is for all stakeholders to also be able to access these products without any additional cost. So totally free. Hence, we have made them publicly available through these links. We encourage everyone to explore these resources and use them. And of course, as part of the quality improvement process, we encourage feedback to be relayed to us and our partner CPG developers. Upcoming tools will be a website incorporating all of these guidelines and a clinician support tool in the form of an app, consolidating the PHEX recommendations on primary care screening, vaccination, and lifestyle advice. So we invite everyone to be involved in the expanded National Practice Guidelines Program. Stakeholder involvement is important because these standards have implications in financing, training, service delivery standards, and these guidelines will actually serve as reference for various government actions. We want the products of the NPGP to help improve patient outcomes, standardize practice, empower our healthcare workers, maximize our health resources, and improve the quality of care in the entire country. So this slide just illustrates the interactions between the standards of care determined by the products of the NPGP and enabling funding and coverage and ensuring quality service delivery. So for instance, the standards of care identified from our guidelines can input into health technology assessment and inclusion in the Philippine National Formulary or the Philippine Essential List, Essential Medicines and Devices List. And this will help DOH, PhilHealth, the LGUs, government hospitals, and maybe even private hospitals to ensure access and delivery. So, for instance, standard of care medicine, which passes health technology assessment, can then be procured by DOH or can be assisted by DOH to be accessed by our patients. Services identified in clinical practice guidelines or in our national practice guidelines can also be used by PhilHealth to develop benefit packages. And then this is true for the LGUs and government hospitals in terms of procurement. So, again, we would like to emphasize that the NPGP has multiple opportunities for stakeholder involvement. For instance, again, for academe, for research organizations, our medical and allied health professional societies, our government agencies, the DOH-attached agencies can help provide information sources through research. Quality appraisal is to be done in-house within DOH, but in terms of standards setting, we also want to ensure multi-stakeholder involvement. So these are the various organizations that could help us. And then in terms of dissemination, utilization, and implementation, we also encourage the participation of different stakeholders. So how can stakeholders be involved specifically? In terms of standards setting, we encourage people to participate in consensus panels and steering committees, to serve as evidence reviewers, to submit CPGs to us for appraisal, to conduct local primary and secondary research. And then in terms of implementation concerns and strategies, we would like to encourage also participation in our interagency councils and technical working groups hosted by the Disease Prevention Control Bureau. And then we encourage feedback on the omnibus health guidelines and later on the guideline implementation tools. And then in terms of agenda setting, we are actually going to formalize agenda setting for research and CPG development this year. And we will be seeking inputs from different stakeholders for these processes. Just a note that as part of our efforts to promote and ensure transparency, which is also a mandate given by the Universal Health Care Act, we have to make sure that the conflicts of interests of people involved in these processes are identified and managed appropriately. So this is true for the entire process and the sub-activities of the National Practice Guidelines Program, but most critically in terms of appraising the quality of evidence and setting the standards of care. So again, this is to make sure that our patients, our end users do not doubt the integrity and veracity of our guidelines. So to give you an overview of COI management, we have to make sure that stakeholders declare non-financial and financial interests and any significant conflict is properly managed. This is again to ensure the integrity of our products. And COI declaration and management is an essential component of the assessment of CPGs, especially on whether they will be recognized as DOH-approved CPGs. So in summary, we enjoin everyone to participate in the following: to adhere to standard CPG development and research processes and methods set by the expanded NPGP and related research bodies, such as the SJREV, for instance, and then to develop high-quality CPGs and research on integrated service delivery that really has an impact on policy, to support the utilization, dissemination, implementation, and monitoring of the expanded NPGP processes and its products, and to provide stakeholder feedback on the applicability, contextualization, and the implementation of the NPGs in the local setting. So again, we have to emphasize here, we don't want us to stop in CPG development. We want these guidelines to be translated to practice and to actually impact the lives of our countrymen. So specifically, these are the stakeholders that are really critical to all of these efforts: the academe, the DOH-attached agencies, the NGAs, the development partners, the CSOs, medical and allied health professional societies, and of course, our very own healthcare workers. In general, we encourage everyone to contribute to the development of a strong evidence base for setting standards of care and to support the utilization, dissemination, implementation, and M&E of the National Practice Guidelines Program. So before we end, we would like to promote this. Please access the Administrative Order 2023-0002 using this bit.ly link and this QR code. And as part of our continuing efforts to improve our products, please participate in this survey of healthcare workers for the updating of the Omnibus Health Guidelines and the development of guideline implementation tools. Thank you very much for listening.
Thank you very much, Doc Dev, for the speech today. And we will now be having our 5-minute wellness break. So please tune in. You can now go to have some drinks and be comfortable. And we will see you after 5 minutes. Thank you so much for listening in.
7 healthy habits para sa healthy Pilipinas. Galaw-galaw baka ma-stroke. Like, bike, jog, jump, rope. I'm stoked. Kumain ng sapat, dapat balansa. Kahit pinggang Pinoy, manami. There you have it. Isa sa 7 healthy habits, sundin. Do it na yan. Kalusugan ay unahin at right. Be clean. Live sustainably.
Get vaccinated.
Don't smoke, lessen alcohol, say no to drugs.
Care for yourself, care for others. Practice safe sex.
Do no harm. Put safety first.
Do it beyond. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas. Sa mundong ginagalawan, pagandaan ng Big One. Kamay, sakit, sa isip sa gawa. If nothing but footprints. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo. Sa ulado ang pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Huwag nang magulat sa kumakalat, matay inulat sa tamang ulat. Ang dapat babakunahan na, mahalaga na bata pa kahit matatanda. Bakuna muna, una sa lahat.
Yeah! Do it na yan. Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo. Sa ulado ng pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Bawal na usok sa atin, baka ako hikain, di nakakagala ang bisyo.
Hi, how can I help you? Dito na tayo sa kakaibang high. GV sa Bishop Lifestyle.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo. Sa ulado ng pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Sa iba'y handa ang balikat ng may karamay sa bigat. Sila'y iniingatan, ngunit sarili huwag kalimutan. Mahalaga ka.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo. Sa ulado ng pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Pag-ibig ang panalo, one love. Isang uri, papugay at papuri. Walang talo sa pagpapasuri. Practice safe sex para sa pamilya at minamahal.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo. Sa ulado ng pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas. 7 healthy habits para sa healthy Pilipinas.
Di sinasaktan, pinoprotektahan. Parang helmet sa ulo pag nasadaan. Isuot na yan hanggang saan makarating. Practice safety over land over sea. See? Ligtas at malakas.
Kalusugan ay unahin at mga nahi ng mamamayan ay healthy Pilipinas. Malakas sa magandang bukas. Ang bawat Pilipino sa mundo. Sa ulado ng pitong ito. Sa healthy habits ko na to. Para sa healthy Pilipinas.
Welcome back to our town hall for the expanded NPGP.
7 healthy
We will
habits
now
para
be
sa
proceeding to our second session. And this is with regards to the updates on the clinical practice guidelines development process in the expanded NPGP. And we would like to call Sir Dan Louis Renz-Tating, our Supervising Health Program Officer under the Evidence Generation and Management Division. You may now take over, Sir Renz.
Okay, thank you, Chelsea. And thank you to Doc Div for giving the overview on the expanded National Practice Guidelines Program Administrative Order. So let me take the time to share with everyone some updates that we have been doing on the clinical practice guidelines development processes in the expanded NPGP program within the DOH. Doc Zash, can I control the slide? Okay, yeah. I think I can control it now. Thank you. So I will begin our session by sharing some of the processes that we noted before the expansion of the National Practice Guidelines Program. So first, we saw that there was siloed efforts in clinical practice guidelines development. There are high burden diseases without available high quality local CPGs. Number two, CPG development was dependent on which diseases would have more prominent stakeholders and those with more financial resources. And finally, there was no clear process for identifying and prioritizing CPG topics for DOH funding. Second, we noted that there was an unclear process for formal CPG adoption. Each disease program would review the CPGs developed for formal adoption, but without clear basis for decision making. There was also no oversight to receive clinical practice guidelines for review and adoption. Hence, this process varies greatly across our disease programs. And lastly, there was no systematic approach yet for CPG dissemination, implementation, and evaluation. All of these processes were very much variable and highly dependent on the CPG developer. Furthermore, many clinicians lack awareness on local CPGs developed. Thus, they are still reliant on guidelines from international organizations. It was also unclear how care providers and policy makers on the ground are able to implement the CPG recommendations, or therefore we are unable to monitor its actual use in practice. So the expanded NPGP framework, as discussed by Dr. Divine, attempts to improve on these previous processes towards the equitable development of trustworthy CPGs. We will go into these refinements in detail in the succeeding slides. The elements on our expanded NPGP framework, as well as the specific strategies that we will be discussing in a while, are based from our review of international best practices coming from the WHO, the UK NICE, the Singapore Agency for Care Effectiveness, the Malaysian Health Technology Assessment Section in their Ministry of Health, and the Korean Academy of Medical Sciences, the mother society of all professional medical societies in Korea. And also, we would like to share that the UK NICE, one of the documents we shared earlier, some of their representatives visited the Philippines for a 2-day knowledge exchange session that greatly informed our ENPGP framework and the AO 2023-0002. Director Nika Hao and Dr. John Derek Cunyo from our division participated also in a 1-week study visit on evidence-based policy development and regulatory standards for health in the UK. So let's move on, and I'll share the process refinements for CPG development. So we have 4. Number 1, the DTCB is the secretariat of the expanded NPGP program to provide oversight and coordination of all CPG development and utilization in the country. Number 2, the medium-term CPG development agenda for 2023 to 2028, which should be the structured and transparent process for guiding funding decisions for CPG development. Number 3, a clearinghouse for DOH-approved CPGs, which will be the formal process using agreed-to instrument for reviewing and endorsing our local CPGs. And lastly, we will also share some information on the strengthened implementation and evaluation mechanisms for DOH-approved CPG, so that everyone will be encouraged to participate in the process. So we will go in detail in the succeeding slides. So first, as we said, the DPCB, or the Disease Prevention Control Bureau at the Department of Health, is the secretariat of the expanded NPGP through the Evidence Generation and Management Division. So we have these work streams integrate the previously fragmented process from funding CPG projects to adopting them in DOH policies. The expanded NPGP further strengthens strategies for CPG dissemination and evaluation, as well as coordination for access to recommended services, technologies, and devices. So our division is composed of two units. So the first one, let me share to you the Evidence Network Management and Learning Unit that handles the process and method standardization for CPG development, the management of DOH-funded CPG projects, appraisal and endorsement of local CPGs, and strategies for CPG dissemination and evaluation. So that's our team. And then we also have another separate unit that focuses on the utilization and policy making. So this is our guidelines and technical standards unit that undertakes the work on adoption of high quality CPGs into policy statements and coordination with FDA, PhilHealth, and HTA to facilitate access to these recommended services. You will also see a third unit that is directly under Director Nika Howe. So the CDC Secretariat supports the preparatory work for the upcoming Philippine Centers for Disease Control and Prevention. The functions of the EGMD on setting service delivery standards as well as ensuring the quality of these work is expected to be transferred to the Philippine CDC once it is established. To further strengthen its technical expertise in guideline development, the DPCB has formalized its institutional relationship with the UP Manila National Institutes of Health through its Institute of Clinical Epidemiology. So showed here in this picture is Director Nika Howe and with Dr. Marisa Alejandria, the Director of the Institute of Clinical Epidemiology, during the 25th anniversary conference of the UPNIH, an MOU was signed to concretize this relationship along four work streams: CPG development, various technical assistance relevant to CDC building, and the third one is internal capacity building and sectoral CPG capacity strengthening. Okay. So that's the first institutional change. The second one is the development of the medium-term CPG development agenda. So this agenda will be developed through our institutional partner, the UPNIH Institute for Clinical Epidemiology. This systematic approach of the prioritizing topics for CPG development moves away from a push model coming from influential stakeholders to a pull model addressing actual gaps and needs for realizing UHC. So the proposed process includes the use of Philippine health data, which will identify candidate diseases or health issues for CPG development and may include burden of disease data, PhilHealth claims data, and primary care visits data. Second one would be inputs from providers, patients, and policymakers, which will provide insight on the actual needs from the ground, implementers, and directly affected stakeholders. So we will likely include professional societies, patient groups, the DOH Central Office, DOH Regional Offices, and others. And a third important component of this agenda would be transparency. We want to have complete documentation on the development process, including conflicts of interest declarations, as also mentioned in the previous session. Just to provide an overview on the steps that will be undertaken, sorry. Okay. To provide an overview on the steps that will be undertaken, we will start with topic generation, following prioritization and ranking, further refinement into guideline topics and pipeline, stakeholder review and dissemination, implementation of the agenda, and monitoring and evaluation to inform the updating of the agenda by 2028. The agenda is targeted to be finalized within calendar year 2023. Okay, so that's for the second institutional change that we are undertaking for CPG development. The third one is on the clearinghouse for DOH approved CPGs. So we've received multiple queries on how they can have their CPGs cleared by the DOH and endorsed. So which CPGs do we appraise? So during the past few years of the NPG program, we have noted that the practice of labeling and considering different guidelines as CPGs, even if these are consensus statements or clinical pathways. To screen CPGs from other guidelines work, we adopt the IOM definition of what a clinical practice guideline is to screen the CPGs that we appraise. And we look at the following. So there should be, number one, a consensus panel appropriate for the guideline work. Number two, it should be based on systematic reviews of evidence. Number three, there should be a rating of the quality of evidence. And lastly, each recommendation should have a rated strength. We accept both externally funded CPGs and DOH funded CPGs for appraisal, as long as they are developed in our local context. Then the next question will be, what tool are we using for appraisal? So we use the agreed-to instrument to assess the methodological quality and transparency of the clinical practice guidelines work. And these were developed to address the issue of variability in guideline development and quality. So this was also revealed in a study by Dr. Dance et al. On the quality of CPGs from up to 2016. So we look at domains. So there are 6 domains: purpose and scope, stakeholder involvement, rigor of development, or this is the methodology of the CPG project, clarity of presentation, applicability of the recommendations, and editorial independence. So it is in this 6th domain that conflict of interests would come in. And there's also an overall assessment. So this is one important innovation or change that we want to announce to everyone. So until 2023, more relaxed cutoffs from previous issuances are in effect to facilitate a transitory period on the quality of DOH-approved CPGs. The minimum requirement to be endorsed to the Secretary of Health is getting at least 75% on both domains 3 and 6. So that's methodology and conflicts of interest. However, by 2024, we shall be adopting the requirement of getting at least 75% on all 6 domains of the agreed-to instrument to ensure that only the highest quality CPGs are used in our national policy making. In our experience of appraising CPGs published starting 2017, we found that domains 2, 3, 5, and 6 are frequently not passed by CPG developers. Hence, we encourage everyone, especially the developers, to use the agreed-to checklist to guide the writing of your CPGs that you are working on or will be working on in the future. Also, to systematize the appraisal and endorsement of local CPGs submitted to the division, we are adapting a quarterly schedule of appraising the CPGs every February, May, August, and November. So with this, the next cutoff will be for the appraisal in May. The cutoffs will be the last day of the month prior to the meeting, prior to the schedule, and the expected release will be the month following the schedule. So if there will be submissions around March, the cutoff will be by April 30 so that they can join the batch of the batch of CPGs for assessment in May, and the estimated results will be released by June. The requirements will be number one, a cover letter addressed to DPCB Director 4, and that's Director Nika Hao. Number two, accomplished agreed to checklist that you can also you access using the link here. And the third requirement is, of course, the full CPG manuscript together with supporting attachments. So this can be the evidence reviews, the complete methodology, COI declarations, etc. So that when we grade the manuscripts, we will have the complete information. And then these should be submitted online through our email, gmp@doh.gov.ph, copy furnished to dpcb@doh.gov.ph. Okay. And to just share that some of the products that have undergone the clearinghouse process, so last year, 34 CPGs were actually approved by the Secretary of Health as DOH approved clinical practice guidelines according with the standards that we discussed earlier. These CPGs can be accessed in our online compendium. So the links are being provided in the chat box. And also, these CPGs were presented during the 19th National Health Research Forum for Action. So later, we will share with you some related activities that we'll have for dissemination. Sorry. Okay. So some of the samples that we have approved as from the DOH would be the COVID living guidelines, the pediatric COVID-19 living guidelines, of course, our Philippine guidelines on periodic health examination, and several on cancers such as lung cancer and hepatitis B also. Okay, so that's the last slide for the clearinghouse innovations. And then the last institutional effort that we are making, it will be on the implementation and evaluation mechanisms. So the first one will be our annual CPG digests. So in the past, all CPGs will have just the manuscript. So now we are moving towards publishing an annual digest of evidence-based recommendations from CPGs. So only the recommendations part. And then hard copies will be provided to all rural health units in the country. So this will hopefully encourage the implementation on the ground. Second, we are also looking into an annual special issue with Acta Medica Filipina to publish our executive summaries in a peer-reviewed Scopus Index journal. So this is one gap that we find also, so that our CPGs can be available to even international users. Third one, we are also strengthening the development of CPG derivative products such as quick guides, mobile applications, algorithms, forms that will support the implementation of CPG recommendations. And as also shared by Miguel in the chat. So one very good example of these derivative products will be the PHEX web app. So please access it and disseminate it to your colleagues, phex.ph. Okay. And then another one, we are also launching NPGP email alerts so that stakeholders can receive regular updates on the latest NPGP outputs, activities, and announcements. So this is one thing that is lacking in the past, and we want to improve on with the NPGP program. And for evaluation, we want to also establish a systematic process and impact evaluation through the use of both quantitative and qualitative data to provide feedback on the development process and actual impact of CPGs. Okay. So other institutional efforts that everyone should look forward to would be number one, support tools for high quality CPG development. This is more for the developers. So we're updating the manual for CPG development with two separate sub-manuals, one focusing on the process, number two, uh, one focusing on the methods. And we are also tapping into enabling mechanisms such as softwares and database subscriptions for CPG developers. Second one will be a certificate course for CPG development. So this aims to democratize access to capacity building for CPG development to increase the available workforce. So this is one issue that we are facing, the lack of people with enough capacity for CPG development. And there will be multiple tracks for different levels of competency. So there will be tracks for steering committee members, evidence reviewers, consensus panelists, and others. Okay. A third institutional effort also will be strengthening public and patient engagement. So this is one aspect that is commonly lacking in our clinical practice guidelines, and we feel the need for strengthening this aspect. This will cover involvement of stakeholders in vetting the CPG scope and questions, as well as external review of the draft CPG manuscripts. And lastly, the UPM DOH Consortium for Evidence Reviews and CPG Development, we hope to institutionalize also capacity for CPG development in academic institutions, DOH specialty centers, and professional societies as well. Okay. And I guess that's all for the summary of process refinements for CPG development. So we have four, and all of the previous discussions just delved into the specifics of each process refinement. And as part of our dissemination, we are also planning now the conduct of the 2023 Evidence Summit coming this October 2023. So this will be conducted as part of the World Evidence-Based Healthcare Day, which is usually celebrated October 20. And hopefully once you receive invitations, please join us in this event. And then thank you very much.
Thank you so much for your presentation, Sir Ren Stating. And we will now be going to our open forum, and we would like to call on Ms. Sarah May Flores, our moderator for the open forum. And she is the Supervising Health Program Officer under the Evidence Generation and Management Division.
Thank you very much, Ma'am Chelsea. Good morning, everyone. I'm Sarah May Flores from the DPCB Evidence Generation and Management Division as well. So you just heard Dr. Agustin and Sir Ren Stating discuss this recently issued administrative order on the expanded National Practice Guidelines Program and the corresponding updates to the CPG development process in this guideline. So we are now moving, as mentioned by Ma'am Chelsea, into our open forum for today's town hall. So we are sure that a lot of us here already have few questions or clarification in mind, as seen in our very active Q&A chat box. You can add your question there or opt to just raise your hand so we could recognize you. For the benefit of everyone here in the call, we would just like to ask those who will manifest their question to just briefly introduce yourself and your affiliation for everyone to know us and recognize as well. So I think we have a lot of people raising their hands already. Maybe we could start with Daryl Deveza Burs. I think you're raising your hand since on the ongoing discussion. How would you like to address how would you like us to address you po? Okay. Okay. Hello? No response. Can we move on to Ian Theodore Cabaluna? Briefly introduce yourself po, how you would want us to address you. Okay, maybe they are still working on their audio. Um, there are questions in the chat box already. Maybe we could start with that po, just to jumpstart this Q&A session. Um, from the very Doc Mel is already typing, but maybe we could answer here as well since we are already in Q&A. I think this is under the presentation of Doc Dib regarding the monitoring po, no? So the question is, can pharmacy professional associations like PPHA and the Philippine Society of Hospital Pharmacists play an active role in monitoring the implementation of the national practice guidelines, and how can we build capacity for pharmacists who have strategic roles in the community and hospital to be involved in monitoring the clinical or clinician practices po? Doc Div?
Thank you po for the question. Thank you, Ma'am Sarah. So actually, we encourage pharmacy professionals to be involved in this entire process. So for instance, pharmacists can actually give us feedback on whether or not our clinicians are following the clinical practice guidelines or the national practice guidelines. What are your observations? So our plan is to periodically release surveys to assess this, and we encourage you to participate in the surveys. Additionally, although this is still in the works, we are thinking of creating a stakeholder engagement program similar to what UK NICE has. So in this program, they usually capacitate the stakeholders to be able to participate in clinical practice guideline development and all the other downstream processes for clinical practice guidelines. Definitely, when we are planning and then eventually implementing that program, we will tap the Philippine Pharmacists Association and the Philippine Society of Hospital Pharmacists. Thank you.
Thank you very much po, Doc D, for the comprehensive answer. And also, as mentioned by ASIC Bev, our communication is always open for any follow-up queries, clarification, and feedback, as mentioned by Doc Div. You can send it at egmd@uh.gov.ph. Another question, maybe we could direct to Sir Renz regarding CPG. So the question is, do we have capacity building activities for specialty societies if they want to develop their CPG so that they will be guided?
Yeah. Thank you, Sarah, for that question. And as part of the certificate course that we are currently doing and planning to launch also, the specialty societies can also course through their participants there so that they will receive capacity development on how to develop CPGs and how to manage projects also.
Thank you very much po, sir. Another question related to CPG, maybe we could answer na rin po since we're already on the topic. Just how can the special societies check if their plans for CPG development is not in the roster of CPGs that the DOH is already planning to develop just to avoid the duplication?
Yeah, okay. So starting last year, we've been publishing announcements through department memoranda regarding the priority topics that we will be developing that year. With the advent of or with the plans to develop an agenda, a medium-term agenda, that the pipeline will be published and our specialty societies can already consult that list. So if ever there will be current initiatives that they want to undertake, they can always email our division, egmd@doh.gov.ph, so that they can check also with our plans if ever they are not published yet.
Thank you very much po, sir. You mentioned din po, maybe just to insert here, you mentioned kanina po that there will be the NPGP email alerts. Will this be also included there po, sir?
Yes, actually. So we'll also have that in addition to our routine dissemination platforms in the department. We'll utilize the email alerts also.
Thank you very much po, sir. Last, maybe on this session, just to close the topic, how do we or how can the healthcare professionals here po and other participants enrolled in the list or the email list po of that NPGP email alerts?
Okay. So I think in our attendance link, we asked for the emails of the participants, and then there was also a question there if they want to join our email list. And then there is also in our evaluation form, there's also a question there if they want to join our email list. So if they answer yes to that, we will include them in the regular list of recipients when we release our email alerts.
Thank you very much po, sir. For those who are raising their hands, Dr. Ian, would you like to manifest already? I think we were given permission po to turn on your mic. Miss Kagoko, just to give opportunity for those who are raising their hands po. Michelle? If none, maybe we could just read the questions again and can just come back to those who are reading. I think we have a lot po, no, regarding CPGs. So can you please show, sorry, is it possible for the externally funded CPG to request for financial assistance from the DOH? Do we have that kind of support, sir?
So with the current trusts of the department, and also related to the development of a structured agenda setting, if their topics are aligned with the agenda priority topics for development, we can provide financial support to them. But if their topics are not uh, included in our priority list, what the assistance that we can provide to them will be more on the technical and how they can align with our processes and quality standards.
Thank you po, sir. So there is a possibility po, no, for the DOH to provide funds, as mentioned by Sir Renz. For Dr. Dante Morales, I think the 34 DOH approved CPG is in the link, sir, right? The posted link po, you can see all the CPGs, DOH approved CPGs there. That is the compendium link po. For the next question, again, for CPG, um, do you have a pool of available evidence reviewers? I think it was touched by user during the discussion, in case we need reviewers who are not neurologists for stroke CPG. Question from Dr. Christina Macroval Valdez.
Yeah, actually, with our experience in working through the UPNIH, um, one of the issues that we're facing is the availability of manpower to do the CPG development. And as we know, evidence reviewers are really important parts of that process. We do not have a pool as of this moment, but if you will recall the discussion that I shared on what you call this, our network, the consortium for CPG development, all uh, all members of that consortium will ideally be capacitated to do CPG projects, and they can get also from that. They can also tap into that consortium if they need.
Thank you, po, sir. I think somehow related to the question is, will the DOH only appraise the submitted CPGs or be part of the TWG committees that develop the CPG? I think just clarifying the role.
Okay, yeah. So the question is composed of two parts. So first, I'll answer. Will the DOH only appraise submitted CPG? So yes, we rely primarily on submissions to us, but we are also planning to do an active scoping rather of CPGs being developed through society websites, networks, etc. Then the second part, will the DOH be part of TWGs or committees that develop the CPGs? This will depend on the funding of the project. So if it is DOH funded, it is the policy of the program that the DOH will be non-voting resource persons during the consensus panel meetings. That is to avoid potential conflicts of interest, being that we are the funder and that it will directly influence our policy making. But if it is not funded by the DOH, the CPG developers are welcome to invite DOH representatives to be part of the committee, the steering committee, or the consensus panel.
Thank you, sir. Maybe um, not entirely related, but somehow part of the overall adaptation discussion is there is a question from Dr. Emerzen Lepano on what is our take in the adaptation of certain CPGs from reputable international medical societies as part of the national CPG.
Yeah. Actually, we acknowledge that CPG development is really resource intensive. That's why aside from the de novo mode of developing CPGs wherein we begin from scratch, we are also advocating for the formalized adaptation process through internationally recognized methodologies such as ADAPTE and the grade development approach. So those are accepted in the National Practice Guidelines program.
Thank you, sir. Maybe just to also loop in Doc Div because the question here is full of CPG queries. Doc Div, your presentation consists of also adaptation of the SOC of the recommendation in the SOC po, no? So there is a question here that if there are specific measures for approved CPG to be included in PhilHealth package or coverage. You mentioned this in one of your slides po, that it could guide the PhilHealth.
Yes, thank you, Ma'am Sarah. So yes, we are actually working on streamlining the mechanisms of making sure that recommended interventions in our quality appraised DOH approved CPGs actually get into benefit packages. And it has been the work of this division to advocate for this services or intervention to our field health, to HTAC, and possibly to FDA in the future. So it's our ongoing work. Thank you.
Thank you very much for Doc Deep. So there will be a future initiative maybe on another forum like this. We will have updates na po on this matter. There is going back to the CPG because we're flooded with CPG questions here po. There is a question if do you think can non-DOH retained hospitals or professional societies access DOH funds for CPG development? I think it's somehow related po with the query kanina regarding funding by DOH in line with the identified priorities.
Yeah, okay. So if there will be professional societies and non-DOH retained hospitals, so like our private hospitals and our LGU hospitals, we encourage them to tap into our current and future CPG development projects. If they will have similar topics along our priority. If they do not have, again, if they do not align with our identified priorities, we will be only be able to provide technical assistance on the process and standards that they can follow so that they will be eventually DOH approved.
Thank you, sir. I think just to also go back to the COI questions, COI discussions, which was briefly addressed po kanina, there is also a related question here. If the agree tool, if we take the agree tool is enough to evaluate COI, we have seen previously, as quoted by by the question as well, we have seen previously approved CPG. So steering committee members are active speakers of pharmaceutical companies of the same topic. So that's the underlying rationale or background for the question, sir.
Yeah. Okay. We recognize the need for us to develop high quality and trustworthy guidelines. So that's why the NPGP framework does include conflicts of interest management and transparency as part of its overarching principle. And then to answer the question, the agreed to instrument focuses on the quality of reporting. And specific for COI, that will be the last item on conflicts of interest are managed and reported. So if the reporting is there and we see that all the reported COIs are managed accordingly, that will likely pass our appraisal for the clearinghouse function. And then we do also welcome what you call this, feedback coming from the ground. So parang whistleblowing siya, no? This is related to science quality. So we found in the US CDC, they do have an Office for Research Integrity So if there are reports that uh, some committee members might have potential conflicts of interest that were not declared, people can also approach the division and report these so that we can look into them. So that's an integrated function within the National Practice Guidelines Program.
Thank you for the answer, sir. For before going back to Doc Div, maybe we could just address one more CPG query. On how long does it take for a CPG to be finally approved by the DOH? Is there any estimated duration po?
Sige, let me answer that question. So we actually plan to publish the DOH, the list of, or update the compendium of DOH approved CPGs yearly. But the assessments moving forward, we plan to do it quarterly. So for instance, if uh, a society or a CPG developer submits a CPG on January, by March, we plan to already have that assessment finalized. But this is in the works. We will actually be disseminating guidelines on this later on, hopefully within the year or by next quarter.
Thank you, Doc Deep. So for everyone, please be sure to register your email so you'll receive the updates as well. So since you're already have the floor, Doc Deep, there is a question here again for technology adoption. So are there specific measures for approved CPGs to be included in PhilHealth? I think this was addressed already, right? Maybe we could just jump to the Philippine National Formulary, which is actually still part of the technology adoption mechanism. So are all medicines in the CPG included in the Philippine National Formulary, like Resecado, Tril, and prebiotics? Or those are the example provided that are still not included in the CPG of acute gastroenteritis?
Thank you for the question. I think our HTA colleagues also responded to some of the questions. So before inclusion in the PNF, they have to be assessed by the Health Technology Assessment Council. And that's actually one of the routes we are trying to explore and expedite right now. But of course, we have to follow what is already set by the HTAC. So they have to ensure kasi that aside from CPGs, the evidence behind the recommendations, they also have to assess cost effectiveness and social implications of including this in the PNF and eventually making sure that these are publicly funded. So from CPG, there's HTAC, then there's PNF. But we understand there's the confusion or the distress caused by some of the recommendations not being included in the HTAC, and we are aware, and on our end we are actually trying also to streamline the mechanisms for that. Thank you for the question.
Thank you, Doc Div. So as mentioned po kanina, the overall mechanism is being followed. So kasama po yung forwarding or facilitation of the HTA process in the overall framework. There's also a question here, just going back to Sir Renz again. Sorry, there's a lot of CPG question really. Or maybe Doc Div could also answer. If the process, if it is mandatory to follow the DOH processes for CPG development.
We want to, basically, what we want is to ensure that all of the CPGs that we use for public health decisions, policies, benefit package development are of sufficient quality. So we would really highly encourage everyone to comply or to adhere with the DOH prescribed processes in order to ensure also that they won't be rejected in terms of the DOH stamp of approval. Kasi sa totoo lang, it's a powerful incentive and it's a powerful tool also to have that kind of approval.
Thank you, sir. Thank you, ma'am. So in relation to that, Doc, there's a question here also. If they will go this route, of course, which we do recommend, how do we get or how do they get in touch with the consortium of CPG developers po?
Okay, baka I'll take this question. So, the consortium is still being planned and formed. Likely, we will be announcing through our dissemination channels, including our email alert system. Once the consortium is already in place and how CPG developers can get in touch with this consortium.
Thank you, Sir Renz. I don't know if we have a lot of time, but there's an important question here that was posted a while ago. I think I missed it. So will the CPG be disease specific only, or there be CPG developed for integrated disease? Health intervention on per life stage basis. So if led by non-DOH, will there be a DOH funding and technical support? So it's like a two-part question. Um, so will there be a CPG that is like an integrated disease framework, and if there will be, or if DOH will support it po?
Okay, yeah. So based on our early discussions, we are planning to have both in our uh, pipeline. So we'll have both disease-specific guidelines still, and we will also undertake integrated guidelines. So the first example of that is our Philippine Periodic Health Examination Guideline. So that's integrated in a way that it's not disease-specific and it covers aspects of the care continuum. So that will likely be continued as a concurrent track in our CPG development. And then the second question, I guess, if led by non-DOH, will there be DOH funding and technical support? If there will be stakeholders that will be interested in pursuing integrated guideline development, they can also link with our current initiatives and be part of that task force. But if they want to if they want to develop on their own, we can provide technical assistance on how the process will be facilitated.
Ma'am Sarah, I
Go ahead,
just
Doc.
want to comment regarding the lack of evidence reviewers currently in the country. Actually, we are also aware of this problem, and we are trying to explore solutions, possible solutions for this. So we are aware that a lot of our trainees, the residents and the fellows, are actually adept at evidence-based medicine. They are being trained in terms of critical appraisal of articles, search strategies, etc. And I think this is one of the ways to go, which is to empower our trainees to participate in the national practice guidelines, and maybe to have also our medical societies recognize this as part of their training in the future. So part of their accomplishments. It's actually just an idea right now, but I'm just putting it out there that this is a possibility. Thank you.
Thank you very much for Doc Deeve for the additional comments, and Sir Renz for the answer. Just going back again, I think there's a lot of concern regarding COI. Sorry, maybe we could just add to discussion more general question before going into the details. So what is the DOH requirement regarding the use of adoption of CPGs in our government hospital, and how will DOH monitor compliance? Still part of the framework that you've discussed before.
Um, the compendium is open for access to everyone, but we encourage DOH hospitals also to create their own um, quality improvement, quality assurance processes. For instance, some of the hospitals have actually created their own clinical pathways, so hospital-specific clinical pathways, trying to incorporate the evidence-based recommendations from CPGs and what is actually available or what is feasible within the hospitals. So as of now, there is no national effort yet to like standardize that. But I think part of the future monitoring and evaluation mechanisms would be to actually look at those pathways and how those pathways are improving service delivery within the hospitals.
Thank you po, Doc. We shared po kanina, no, the various tools that they could use for the adoption of the guidelines that we are releasing or approving. So there is a question here on how will the PHEX guideline recommendations be applied to annual checkup programs of government agencies? Sorry, Doc, you are on mute po.
Sorry. So thank you po for the question. The DOH is currently in discussions with the Department of Labor and Employment in order to streamline this. But also on our end, we are trying to complete all the phases of the PHEC so that when we present the recommendations, they are going to be complete and comprehensive. But definitely, it is also in the works. Thank you.
Thank you po, Doc Div. I'm seeing a lot of questions still coming in. If we were not able to address your queries po due to the limited time that we have this morning, just feel free to resend it to our email, egmd@uh.com.ph again, and we will be happy to respond and clarify any queries po. And on the topic of clarification, and of course, on the implementation and adoption of health technologies or the CPGs, we received comments lang din po or clarification from our HTAD colleagues po regarding the various queries regarding the HTA of health technologies. So just to answer the query, yes po, the PNF, all the products po that will come, that will be included in the PNF and even the the PE, and the list for medical devices will have to go through the HTA process po. So there's no separate formulary committee anymore. So they will assess it po. So in that sense, those products po that is included in those lists as well, even if the LGU or government hospital will procure it, will have to be HTA assessed. So I think there's just a slide po that they have been misconstrued, that there's a separate assessment process that we have po kanina. For next question, I think it's more of a comment. If we could include the management of drug susceptible and drug resistant tuberculosis in the NPG, which is common in public health setting. So I think
Yes po.
Yes, we can.
So just to give you an update, we are assessing the updated TB guidelines. And we will probably be able to release that if it passes quality appraisal within the year. And then there are also efforts within the department to publish interim guidelines on this, because as we all know, there are a lot of developments in the field of tuberculosis. Thank you po.
Thank you for the updates, Doc. Another question from Doc Enrico Tanco. What happens if a patient does not follow the guidelines due to financial reasons?
Um, Mahirap po yung tanong, no? Pero that's the role of DOH and the entire health sector actually. So DOH on our end, we want to make sure that what the guidelines recommend are accessible and affordable, procured by the government if that's the way to go, public procurement. So ayun po, multiple efforts from the players in the health sector. So it's not the burden of the patient to shoulder alone. It's not the patient's burden alone. Thank you po.
Thank you po, Doc. I think that is also why we have the knowledge translation po, no, in linking these standards with PhilHealth, with HTA assessment to ensure that it is feasible to roll out, and also it could be covered if the financial capacity of the PhilHealth will permit it as much as possible. There's also I think more of a comment rather than a question. So from Dr. Ana Sofia Victoria Fajardo, PCOM can help align CPGs on periodic medical examination or PHEX, which we are currently working on to enhance initial examinations included in DOLE OSH standards. Thank you for that. Sorry, I think the rest of the question has been mostly answered. For those who are in the chat, maybe we could, in the call, maybe we could give opportunity as well. Ma'am Alessandra Alawadin, how would you like us to address po? How would you like us to address you po? And please introduce yourself before posting your query. Go ahead, ma'am. You're given permission to unmute. If none, Ma'am Michelle, go ahead po. We haven't heard anyone since we started this Q&A. But thank you everyone for all the wonderful questions. If we miss out anything, please feel free to send us your inquiries po and or clarifications. If none, okay, maybe we could answer one more query, or two more query. I think based on our timeline, we have until 11:15. So one more query regarding PhilHealth package. Maybe a lot of are having queries in their mind regarding the translatability of this guidelines to our patient and of course the funding. So is a CPG needed for the revision of the PhilHealth packages, or pwede na clinical pathways lang? From Dr. Christina Valdez.
Ideally po talaga CPGs because that's the source of standards of care as mandated by the UHC Act.
Thank you po, Doc. There's a question here regarding the role of private sector. I'm not sure if we have participants from private sector, but maybe we could also answer this one as guide for our healthcare practitioners, CHDs as well, on how to respond to them if they raise the question. So what is the role of private sector and pharmaceutical company in CPG development?
Actually, the private sector can be involved in terms of the consensus panel. In terms of the pharmaceutical consensus panel, so the group of people who are actually making the decisions. In terms of the pharmaceutical companies, they are actually allowed to nominate topics for HTA, and they can provide the information, the evidence needed by our HTA council in order for them to make sound decisions. Usually naman kasi yung pharmaceuticals natin, they're also basing their what they generate as evidence, actually inputs also into CPG development. And these are submitted to HTA and FDA.
Thank you very much po, Doc Div. So this, maybe just to add, no, so this process nga po is um, implemented, or the framework is here is prescribed para din po masanay, no, yung mga pharmaceutical companies on how we deal or standardize how they could actually share their data on which route to take to share, so they can share their data and include it in our standards if it's a promising commodities or promising intervention as well. So with this, we hope that they will be very much guided on who to approach and what to bring in the table as well. Maybe just last question before, since we have only a few minutes left. So will professional societies be allowed by DOH to disseminate the guidelines through their own channels?
Yes, we actually encourage widespread dissemination. So we are not restricting it to DOH. So please go ahead po.
Yes, big smile and big yes from our Div Chief po. Yes, please help us disseminate, share information. I think we will also share the slide po, no, Doc? Or maybe a briefer on this, so you can also hand it out to your network. Maybe just to reiterate some points of this town hall, Doc. Sorry on putting you on the spot, but since we're almost out of time, any main message that you would like the audience to take away po? Reiterate our call to action.
Yeah. Thank you, Ma'am Sarah. So there is a lot of interest in terms of this initiative, and we thank you. We thank everyone who participated. We would like to encourage everyone to look at this initiative as something that will really impact the health system, the health of all Filipinos. So what we want are standardized, safe, quality, timely, and patient-centered care, and well-written, well-conducted, well-developed clinical practice guidelines and other public health guidelines will actually enable this. So we hope that everyone who is here today and can actually help us generate more interest and perhaps participate in the processes we actually listed down before. So para po sa bayan, para sa Pilipino, let's all work together. Thank you po.
Thank you very much for Doc Div. Again, reiterating, this is a new AO that just was released this year, and we will really appreciate any comments po. We will flash here po a slide. So for any comments, you can visit, or more details, you can visit the QR code posted po. So any comments is welcome. You can visit the survey link, or you can send us again the comments or feedback regarding this po at egmd@doh.gov.ph. That's it for our open forum po. Apologies for those who will not able to entertain your questions. Send us an email po, and we'll respond to you accordingly. Handing the floor to our Director Nika Hao, for the closing remarks.
Thank you, Sarah, and thank you to everyone, 900 people strong, who joined us in this webinar for today. So I hope with this short session, you were able to see and appreciate that we in the government are actually really taking evidence-based medicine seriously, and that we've known that this has been a long clamor of the sector for time immemorial. So this is the government and the DOH's commitment to start really doing all of this work. And as you can see, this is really going to be a work in process that we'll have to further refine with all of you. And yung opportunities po like this is our venues to discuss and also find ano yung mga future areas natin of improvement. So we've started in 2022, but we hope to really build this in the future, and maybe in future discussions we'll also talk about how we envision this being among the priority programs under the future centers for disease control of the Philippines. Rest assured, you have a very passionate and capable team who will be very responsive to all of your concerns and all of your needs. I also want to share na I hope everyone also understands and appreciates na itong National Practice Guideline Program is one of the tangible ways wherein clinical and public health can work together, especially for promoting public good and public policy. So we do hope to engage all of you in all of the steps that will have to happen in this. So not just in the CPG appraisal, but even in all of the questions that you've been raising about adoption, implication to our policies, improvement, and even the promotion on all of these things. Itong town hall po natin today is a mix of representatives from professional societies, mga on-the-ground health service providers, different offices and policymakers of the DOH offices. And it's clear na sa buong proseso pong ito, lahat tayo may important role to be able to do. So we really hope that we can leverage all of our expertise and all of our resources para talagang magamit natin itong evidence-based guidelines na ito into actual services and interventions for the people and the patients that we serve. And that includes many of the hard questions that we're seeing in the chat box about compliance. So definitely yung pag-ensure na nasusunod tong guidelines na ito is not just going to be something that DOH can do. Definitely on our end, this will impact also what are the things that we will require to monitor across all of our reporting platforms. Pero definitely, the medical society should also be making mechanisms to police among their ranks, all of the other stakeholders, even our hospitals, to have their own policies, and everyone to be vigilant na only evidence-based kinds of interventions are at most what we'll be sharing to everyone. So lahat po ito ginagawa natin para sa ating mga kapwa Pilipino, and personally, I'm very enheartened na dumadami at nag-grow yung support for this program. So I do hope to see each and every one of you in all of our future work in relation to all of this. And rest assured po na madami pa po kaming platforms to discuss and to co-brainstorm with all of you on our directions forward. Maraming salamat po and congratulations din to our team for this very successful webinar. Thank you po.
Thank you so much po.
Thank you so much po, Director Rizel Nicahao, Director 4 of the Disease Prevention and Control Bureau. So I guess this pretty sums up our town hall for expanded national practice guidelines program. And on behalf of the Department of Health and Disease Prevention and Control Bureau, and also from our division Evidence Generation and Management, we would like to thank all of you for attending this town hall, and we hope we were able to address your questions and your concerns for today. So if you have any further queries, you can always reach us at egmd@doh.gov.ph. So please do not forget to fill up the attendance sheet and answer the feedback, which is posted, or the QR code is already posted on the screen together with the link. And we will actually issue a certificate of attendance upon accomplishing the form. And once again, thank you for your time and attending our town hall for the expanded national practice guidelines program. And we wish to see you all on our next event. Thank you so much, everyone. And
Thank you,
may you have
everyone.
a blessed day ahead. Thanks. Kindly try to scan the QR code again for the evaluation. And yeah, it's up and running. Thank you so much again po for everyone who have attended. And we hope to see you on the next event.